I'm back with yet another YouTube video because I feel like the first one I didn't really cover the step-by-step of what to expect once you're admitted into surgery. Once you're admitted into hospital and on the day of the surgery. So I thought I'd do another video, a short one, just taking you through that, because I know that was something I was really worried about myself. So the day before surgery, I was admitted into hospital to have a HSG test, and the HSG test is basically an x-ray of your uterus. They want to check your fallopian tubes and check the uterus. They kind of open you up and put a dye in there so that they can take the x-ray. Mine went on for like an hour because they had to keep putting dye in to have a look at the right side. The right side was a bit problematic, so that was quite uncomfortable. I really didn't like that. But it's nothing you can't deal with. After that, they gave me, I think, painkillers, injections in my thigh to help the pain I was in already. And then I had to fast from 10 p.m. that day until the end of the surgery, till after the surgery. So I was fasting, I couldn't even drink water after 10 p.m. And the surgery was scheduled for 9 a.m. the next day. So by like 5 a.m. I was up, showered. I wasn't allowed to put any creams or oils on my skin before surgery. They gave me the surgery gown, and then about 8:39 somebody came down to take me into theatre, and I was so nervous. Oh my god. Thankfully my auntie was there, and my friend Matilda, she was there too. And then I went into theatre, like the theatre ward, which was quite nice. They make you take off your shoes whilst you're outside. You put on Crocs, walk into the ward, and I was kept in a recovery room waiting, because the anesthesiologist was running a bit late. So my gynecologist, who was the person who was going to be carrying out the procedure, came in to speak to me. She was lovely. She explained to me exactly what would happen again, gave me a consent form to sign just in case of anything. And it's funny, when she walked in, I was sitting cross-legged meditating on the bed like this. I was trying to ground myself and call my ancestors, because I was scared, I was petrified. So I was like, breathe, you can do this. And I was grounding myself, I was calming myself. I was like, it's D-Day, this is what you've wanted, you are here, we're gonna survive, we're gonna be amazing, And then she left, and then the anesthesiologist came, like 30 minutes later to see me. And I was a bit worried because obviously I decided to go the general anesthesia option. And there was an option to have an epidural, so you'd be awake whilst they were doing it, but that just sounded like a nightmare. I had no desire to be awake. From some of the videos I'd watched, some of the women were awake, and it got to a point where they could feel pressure, not pain, but pressure. I just didn't want to be awake. I wanted to be asleep, and when I wake up, it's done, So the anesthesiologist came to talk to me about that and how it would work. And I was a bit worried because, I smoke marijuana every now and then. And I'd seen that marijuana use can affect the doses of anesthesia. So I just told him about that. We talked about that. And then he was like, do you want me to pray with you? And I was like, yeah, absolutely. I need all the prayers I can take. So he prayed with me. And then it was time to go into the actual theatre. Oh my God, I remember being so nervous, thinking, oh, okay, we're about to do this, But so I walked into the theatre. The theatre was nice, it was clean, it was like high standards and stuff. Everybody in there was so friendly. It was obviously my gynecologist, the anesthesiologist, his assistant, and I think 2 nurses. And on the board they had my name, my age, the procedure I was carrying out and stuff. And they did this thing that I really liked, right? All the people within the theatre introduced themselves. They'd say their name, what they did, and what they'd be doing during the operation. So that made me feel at ease. And at the end of them, like for example, Dr. so-and-so, gynecologist, Dr. so-and-so, anesthesiologist, assistant, whatever. So when they were done, I was like, Tissel, patient. I was trying to, like crack some jokes to kind of ease my, fears. And so the anesthesiologist was like, okay, they were putting the anesthesia in, and he gave me some gas as well. And whilst he gave me the gas, he was like, okay, would you like to say a prayer? I said yes. So I'm praying, and I'm like, praying for a successful surgery, and that's the last thing I remember. I was gone. Next thing I know, I wake up and I'm in a recovery room, and I'm like, oh my God, I made it. I made it. Oh, I made it. I was sleeping for a while. I think it's 4:30. This procedure started at 10. I'm fibroid free, motherfucker. I made it. But the first thing I feel is my bum. My bum is quite numb, like really numb, like uncomfortably numb, that I had to move it. But because I'd obviously just been cut open and the muscles down there weren't working at all, I couldn't move. So I had to call the nurse in, and she had to kind of like shift me a bit to kind of give me a bit of relief. That's what happens when you're carrying junk. But to be honest, I read about that online as well, about some women had like sores on their bum and stuff, and I did get like a dry patch for like a week or two, but I just sort of used oils and shea butter and it went back to normal. But yeah, so I complained about my bum, and then I also complained about pain straight away when I woke up. It was quite sharp, obviously in the incision. That was about, but it wasn't too bad. It was like a 5 out of 10, but I was just like pain. And the nurse gave me morphine, and obviously I've never had morphine before. You know, I know it's not that great, but honestly it was so great for the pain. Oh, it took all the pain away. I was floating. I even got my phone out. I was able to do a video because of that, you know. So the doctor said, so I came around, the surgery was from 10 o'clock till 1 o'clock, and I came around about 4:30, and then I kind of stayed down there till about 7:30. And I remember my doctor telling me that I could drink water. I couldn't eat that day, but I could drink water after 7. So they took me up, and when they were taking me up, that's when I felt the worst. They put me in a wheelchair to wheel me up. Coming out of the bed was stressful because obviously the muscles aren't working there, you know, fresh out of surgery. And the motion, I think the motion of the wheelchair just made me lightheaded. I was dizzy, I was sweating. We're gonna cover you now. And I really needed water. Obviously my body's dehydrated. I'm somebody that drinks a lot of water. I literally have water here with me, you know. So I needed the water, and there was some confusion at first as to whether I could have water. So I was like, call my doctor. She said I could drink water at 7. So they called my doctor, and she was like, let her have water but give her sips. So I had to sip it. I wasn't allowed to, you know, back it, which really helped me. It helped me so much, like, and then they put a catheter. I woke up with a catheter inside me, and a catheter obviously is to help drain my bladder, so I wouldn't have to worry about going to the toilet by myself for the first 24 hours. After 24 hours, they took it out. It was a bit uncomfortable when they were taking it out, but you know, whilst it was in, it was fine. It was great, especially coming from me that had been using the toilet like flipping 20 times a day prior because of the fibroids. So it was nice to not have to worry about that. What else? They gave me my compression socks the second day, obviously to prevent blood clotting, and I found those quite uncomfortable. Honestly, I really didn't like them, and I had to wear them for 2 weeks after the surgery. So, but they helped with the blood clotting. So I was on morphine, paracetamol, Gas-X, Lactulose for stool softeners, antibiotics. These were all intravenous apart from the Gas-X and the Lactulose. But I was on antibiotics, morphine, painkillers, and then they also gave, but the morphine was only for 3 days. And then they swapped everything to orally. So I was taking tablets and liquids, like because I went the general anesthesia route and not the epidural routes, they had to put a tube down my throat to help me breathe. And the tube down your throat, I'd read about this prior, can cause a lot of mucus in your throat when you come round. So I had a lot of mucus in my throat that I kept trying to get out. And when I would cough up, it'd be black for the first couple of days, like slight bits of black. And so they gave me like a drug, I don't know what it's called, it's a syrup to basically clear my throat, make me cough it up, which is not ideal when you've just had a abdominal surgery. You can't cough because it's hellish. It was, honestly, coughing was horrible. So instead of coughing, I couldn't cough properly, so I would get a pillow. I had a pillow with me, so take a pillow with you, it's really important. I took my own sheets to the hospital because I'm extra, but you know, and my friend bought me a pillow as well, I'm extra, but I brought an actual cushion, and I would hold the cushion to my stomach, and I would kind of make this noise like because I couldn't do a big cough, so it'd be like until the mucus would come out. So I was like that for a few days, and the cough was really annoying, I can't lie. The drug that was making me, I needed the drug to make me cough, but it was really uncomfortable. I really didn't like that at all. And then what else? I wrote notes so I don't forget anything, because I felt like I forgot last time. Yeah, so sitting up as well was pretty hard. You have to, it's difficult. You kind of have to psych yourself up to make sure that you don't move a funny way and aggravate the incision, you know. So sitting up was quite hard for the first 3 days, and then I think after like 4 or 5 days, I was able to sit up better, you know, with not too much stress or pain. And then I started to feel the muscles down there again. I couldn't feel them for a while, and even now it's quite numb around that area. I think I'm going into my 6th week now, and it gets a tiny bit sore, but not majorly sore at all. None at all. I don't really need painkillers. I've stopped taking my painkillers like a week after hospital. But it is numb there. It's numb around the wound, and I read that. I didn't know that it would get numb. I also had this thing called a belly overhang actually, which I wasn't prepared for. So basically the muscles down there, after the sort of traumatic surgery, it can sort of hang because of the trauma, but it's back up now. So my belly hung for a few weeks, but it's now, you know, gone back up, and it's still swollen actually. My womb is actually still swollen, but it's a lot better than it was before. And I have to say, like, my waist is smaller, my belly is a lot flatter, obviously taking out nearly 1 kg of fibroids. What else? I was very short of breath. That was another thing I noticed. From day one, as soon as I left surgery, I was short of breath for like a week even, but the first 3 days were really bad. I really couldn't talk much without getting out of breath. I was so tired. I'm still tired now, to be honest. That's one thing I noticed. I get very, very tired. I've been moving up and down, you know, I've been agile, I've done so much, but yeah, the tiredness and the short of breath was something I noticed as well. What else? Yeah, I think that's it. I think I've touched all the things that I wanted to touch on. Thank God, because I didn't feel like I touched everything in the last video, and I just wanted to know, I wanted to give you a sort of idea of what it would be like whilst you were actually in hospital. So I hope that has given you some idea. And again, honestly, my darlings, I know that you're going through a lot right now, because people, unless you have the fibroids, people don't really understand just how horrific they are and how anxious you get about the surgery and stuff, you know. So I hope this video has been able to kind of prepare you for what it is you will be happening, and I wish you an amazing successful surgery and an amazing recovery and healing. You're gonna do great, and you're gonna love the fact that you went ahead and did it, because your quality of life afterwards is gonna be amazing. You know, you deserve to have a life without these parasites inside you, you know. So yeah, best of luck, and if you have any questions at all, just write me in the comments or send me a DM on my Instagram. Taste of the stars.